Hello and welcome to the McLean County Community Behavioral Health Forum. We are happy to have you here again with us this afternoon. My name is Kevin McCall and I am a behavioral health specialist with the McLean County government, and I will be standing in for the Behavioral Health Coordinating Council Supervisor, Trisha Mallott, who sadly could not be with us this afternoon. I'd like to start for a minute, as I usually do, and talk about the forum itself. The McLean County Community Behavioral Health Forum is typically a one-day event consisting of multiple breakout sessions. But with the ongoing global pandemic, we have adapted our in-person format and are pleased to offer a wide variety of individual sessions related to behavioral health that will be offered through April of 2021. Please check our website for a full listing of these sessions, which include topics such as COVID-19, restorative practices, coping strategies, and much, much more. All registration is free and you can even register the same day. Sessions are held at varying times to allow for maximum participation by community members, but all presentations are uploaded to the McLean County Behavioral Health YouTube page so that you can view them at any time after. I'll provide links for both our website and the YouTube page in the chat that's located on your sidebar. And I would encourage you to check back there regularly as we do make new additions and add new speakers as we get our planning committee to provide those to us. We hope that you'll continue to join us for the next several months. Even with a new look this year, the idea of free community education and sharing of ideas originated out of the Mental Health Action Plan, which was adopted by the 2015 McLean County Board. This plan originated out of more than 100 community members that identified needs and best practices related to behavioral health specific to McLean County. In these uncertain and difficult times, we believe that it is more important than ever to help provide education, resources, and encouragement, or even simply recognition of life's challenges. During today's presentation, there will be a time at the end to ask questions. We ask that if you choose to ask a question during the presentation, that you provide enough context so that our presenter can answer that question appropriately at the end. So if something comes up in the middle, please make sure that you're providing a full question so that at the end, Stacy can actually go ahead and give you a full answer back. At this time, I would like to introduce today's speaker, Stacy Wiggins. Stacy Wiggins is in her second year of the Master's Social Work program at Illinois State University. She received her bachelor's degree in social work at ISU in 1994. She is currently at the First Star Academy ISU College Prep Program for Youth and Foster Care. Stacy has over 24 years of experience working with families on self-sufficiency, mental health, life skills, career training, and crisis intervention at Bloomington Housing Authority. Stacy has also been a presenter at regional and national conferences for the U.S. Department of Housing and Urban Development. She worked as a graduate assistant with recruitment and management for the Master's Social Work program at ISU, and she is a 2020 recipient of the Diversifying Higher Education Fellowship. She is excited to graduate with her MSU in May 2021 and is looking forward to next steps in her academic and professional career. Stacy lives in Bloomington with her husband and 2 daughters. I'm happy to introduce Stacy Wiggins.
Good afternoon. Can you guys hear me? We good, Kevin? Good afternoon. It is an honor to be here. And I thank you for that nice introduction, Kevin. Kevin and I were classmates in the same program last year. And so it's really nice to reconnect with him. So we are going to dive right in to my presentation. And it is called Understanding the Unique Needs of Mental Health Care for BIPOC, Black, Indigenous, and People of Color. But I added a little something to it. And you'll understand the theme of my flow throughout the presentation. So what I added to it is what's in a name. So I will ask you, have you ever heard that phrase, what's in a name? This is a heavy topic. It's a serious topic, but I like to keep things a little light and lively. So I will start off light and lively before we get into this heavy topic. I don't know if anybody has heard that phrase, everybody has a twin. So my twin is here in Bloomington. A few years ago, we actually met, and we had very similar stories because I could be in Walmart, the gym, and people would come to me and say, like tell me their life story. Guess what? I graduated from college. I got a job. I did this, I did that. And I would be like, baby, that's so wonderful, but I'm not who you think I am. So I actually started connecting who this person is, and we met face to face at a basketball game. And come to find out, she was having similar situations. People coming to her, telling her their life story. And the funny thing is, we're both Black women. We are both in helping professions, right? And we have very similar features, and we even have a lot of the same characteristics and personality. And it was really an honor and just hilarious to meet her and for us to be able to say, people confuse me with you all the time. But we're two different people. I'm Stacey Wiggins. I'm not going to share her name, but it's not Stacey Wiggins, I'll tell you that. We're two different people. So as we flow through this presentation, I'm going to talk to you about groups of people who have a lot of similarities because of the same ethnicity, same culture, but at the end of the day, they have different names. And when you meet them, that's the most important thing I want you to take away from this. Although there are similarities and we're going to look at statistics and we're going to dive into a lot of the issues and things that are happening, you keep that in mind, but I want you to connect it to their name because everybody has a story and everybody has a name. All right, so we're going to dive into it. Names are important and they shape our identity. So like my twin, we have a lot of similarities, but there are a lot of differences, a lot of things that we have that are different. And as we grow and change professionally, we are able to adapt how we speak about people. So to be honest, this is new also for me, the way things have changed. So let's look at how things were previously. Okay, so minority, marginalized, powerless, unequal, belittle, inferior. And these are the names that we were previously calling this population. But now we've made some changes. What we say now is BIPOC. And what does that stand for? I want you to understand what this stands for so that you can follow along with the rest of the presentation. So B stands for Black, Black people. I, Indigenous people. P, people of color. And we want to connect that to empowerment and resilience. Now you look at those two categories, minority, marginalized, powerless. And then you look at the other side and you see empowered and resilient. That's the lens that we want to view this population through. So your name is your experience. This information came from Mental Health America. They have chosen to remove the word minority from their toolkit and will be phasing it out of their materials. Instead, we're using a different designation, BIPOC, which I just went over with you. Why? Because they believe that it more fairly honors and distinguishes the experiences of Black, Indigenous people, and people of color. And as mental health professionals, we want to operate with the utmost respect, and we want to operate from a strength-based approach. So now we're going to go through some statistics about each of these areas that I've just shared with you. And I challenge you to look at there's one word that you're going to see in all of these slides and these statistics, and this word bugs me. Now I want you to look at, I'm going to share this with you, and when we're done, I'm going to ask if you may connect with this one. There's one word that's in every slide and it bugs me. All right, so first we're going to look at the statistics with African Americans. So 13.4% of the US population identifies as African American. Of those, over 16% reported having a mental illness in the past year. That is over 7 million people, more people than the whole population of Chicago, Houston, and Philadelphia combined. Now we'll look at statistics for Native Americans and Alaskan Native, and this is our indigenous population, okay? 1.3% are in the United States. Of that, 19% reported having a mental illness in the past year. That is over 827,000 people, enough to fill every major league baseball stadium on the East Coast, times 2. Now we're going to look at statistics for Latino and Hispanics. 18.3% of the US population identify as Latino and Hispanic. Of those, over 16% report having a mental illness. That is over 10 million people, more than the number of people who live in New York City. I believe this is my last one. Asian Americans, 6.1% of people identify as being Asian American, and of those, nearly 15% reported having a mental illness in the past year. That is over 2.9 million, more than the number of dentists, post-secondary teachers, and lawyers in the United States combined. So before we go any further, I wonder if anybody has caught, and I'll ask you, Kevin, there's one word that's in each one of these slides, and it kind of bugs me a little bit.
Yeah, I'm not exactly sure which word you're going to pick, and I have a hard time guessing at that. Let's see if someone maybe in the chat has a better guess or is more brilliant than I am.
I'll give you the answer if you don't, if nobody said it in the chat, but I'm wondering if anybody caught it.
Someone's asking identifies, question mark?
Nope. Any other guesses?
Combined,
Nope.
Second guess?
No, but thank you. Can you guys please keep communicating with me? I appreciate it.
How about illness?
I like this though. This is good.
Angela says, is it Asian and African American?
No, I'm gonna shift you guys over a little bit. All of these slides have the word reported. The reason why that bothers me is because I am almost positive that these numbers overall have some inaccuracies because this is only who's reported. That means these are people who have sought treatment. Somehow it's been reported. I honestly believe that if we looked at overall, even unreported, undocumented mental health conditions in this population, that number would go up. So the reason why reported bothers me is because of the fact that I really wish there was a way to put in here, like, you know, there's a way to know that there are several that are unreported, untreated, and this is what else we'll talk about for the rest of the slide, the rest of our presentation here, unreported and untreated. And to be honest, those are the ones that concern me most because at least here, these people have been reported. So somehow they've gotten in contact with somebody that is able to provide some support for them, or at least identify that this person has a mental illness and needs some help. But what about those who are just out here with no help, no voice? So let's keep going. We're going to go to the next slide so we can look at why this is so important. So there are mental health disparities in this community as well. Why? We realize mental illness does not discriminate, does it? It does not discriminate across the board, no matter race, ethnicity. But it's the consequences of it that's a concern for us as mental health professionals. The consequences are greater for people in the population that we are talking about today. So the consequences of mental illness in BIPOC are persistent and long-lasting compared to whites. They often bear a disproportionately high burden of disability resulting from mental disorders. And I would ask you, why do you think that the consequences of mental illness are greater for people who are not white? That's really what we're saying here, is that the consequences. So we know that mental illness affects everybody, but the consequences are greater. So you don't have to answer that right away. I'm gonna go to the next slide, but this is something I want you to think about because we are gonna dialogue. So why should we be concerned? And this is a little bit answering the question that I just asked you. But I think if we really sit here and talk about it, we could go on and on for days, really, about the consequences. So there's a disproportionate rate of Blacks in the criminal justice system, homeless, unemployed due to mental illness. Indigenous Americans report the highest rates of PTSD, alcohol abuse, and mental illness overall. People who identify as being 2 or more races, so again, remember we're talking about basically non-whites, are most likely to report any mental illness within the past year than any other race or ethnic group. Youth with behavioral issues are more readily referred to the juvenile justice system than to special primary care compared with white youth. Minorities are more likely to end up in juvenile justice system due to harsh disciplinary suspension and expulsion practices in schools. So we see that this trickles a lot beyond the individual, their family. Now it is affecting literally their quality of life, literally their ability to be able to function well in the community. So this is why we should be concerned, and this is why this topic is so important for us today. So let's look at what the burden looks like. I just told you that the consequences are harsher. Why is it a large impact on people that are not white and when they are affected by mental illness? What is it that's going on? So this slide talks about that. An important factor contributing to greater mental illness among people of color is the trauma they experience from encounters with prejudice and discrimination. They can range from daily microaggressions to extreme violence. Have we not been seeing this in the news? As a community, their mental health burden is greater as a result of social stressors they face, whether directly or indirectly related to race. Research suggests that stress related to daily discrimination negatively impacts minority mental health, and this leads to worse physical health as well. Okay, so now we are seeing that there is a large connection. What's already going on in their mental health and also connects to their physical health. And with the disparities that we just discussed, we are now seeing that these people are not being treated, or they're being undertreated. That's another term I'd like to just add to your vocabulary. Maybe they are being treated, but they're being undertreated. Let's look at the picture. One of them says, "No, where are you really from?" And the other one says, "You don't act like a normal Black person, you know." These are microaggressions. These are microaggressions that are showing really a disrespect for the individual. What's in a name? What's in a name? That's why I'm calling this presentation that, because the pictures that we see of these people here, there's more to them. There's multiple layers of all of us, right? There's multiple layers to me. There are multiple layers to people that are in this population that we're talking about. And if all they're being seen as is not white, and then they are being discriminated against and having these microaggressions, of course, that's going to cause added stress. And of course, that is going to make the consequences of the mental illness a harsher burden than other people who may not have to deal with that. Okay, let's go to the next slide. So I kind of mentioned some of these already, but these barriers, you know, it's very difficult, I would think, for anybody to make that step to seek help for mental illness, to see a therapist, to take the medication. It's a huge step to be able to surrender, so to speak, to the help of somebody else for what's going on with you mentally and emotionally. It takes a lot of courage to be able to do that. So what concerns me about the facts that are on this slide is that after somebody finally gets the courage to reach out for help, they're faced with barriers. And that's our concern. So what are the barriers? Nearly 90% of Latinx Hispanic people over the age of 12 with a substance abuse disorder did not receive treatment. So that kind of takes us back to some of that reported word that I don't like. Poor communication with healthcare providers. Now, This one is really important to me. In my line of work, I have advocated for my clients at schools, at medical facilities, and my next point here says a shortage of bilingual or Spanish-speaking mental health professionals. Some of the people that I was advocating for spoke very clear English, but they still faced barriers. And honestly, it was because of the overwhelming stress that they were already under. It was very difficult for them to self-regulate, to be able to communicate what was going on with them. So that poor communication, I want to really point out that that could be speaking a different language. That could be due to other burdens and stressors that you have, and they're just not able to truly be able to communicate what's going on with them. And to be honest, whoever they are communicating to, that professional, sometimes is kind of trying to hurry up and rush them along so they can get to the next person. That's another point. I'm not going to get on my soapbox about that. So I said shortage of bilingual or Spanish-speaking mental health providers, professionals. Bilingual patients are evaluated differently when evaluated in English versus Spanish, and Latinx Hispanic people are more frequently undertreated than whites. Lack of insurance and underinsurance, that is another soapbox issue for me. So I won't take a lot of time on it because we will be here all day, but that is a huge issue. I really don't understand why, as progressive as our country is, we don't have better insurance, medical insurance for people. I honestly believe that if people had better insurance and didn't have that barrier to face, then they would be able to help them to open up their mouth and say, hey, I need some help. Now, if you feel like, you know, all I did was stub my toe and it took me forever to get treatment because I'm underinsured or lack of insurance, I'm sure not going to open up my mouth and tell people about my depression or anxiety or, you know, bipolar disorder. So they don't want to open their mouth because they've already faced so much, even just with regular basic health needs. Off my soapbox. Okay. Distrust in the healthcare system. All of the things that we've been talking about really lines up with why there is distrust in the healthcare system. And we're going to touch a little more on that as well as we move on. Let's talk about this last one. Mental illness stigma is often greater among minority populations. If anybody would like to put in the chat, I'd like to hear why you think that the stigma is greater among this population. You know, as mental health providers, you know, we're doing our best. Like Kevin said, I'm in classes now, and I've definitely spent some time out here in the field. I feel like we're doing our best to say, it's okay, please come, we welcome you, come on. Come on, why don't you come? Why don't you come? Why don't you, you know, and we're wondering like, why aren't they coming? Well, there's a reason for that. And that stigma sometimes it does have to do with what's going on with other professionals that they've kind of had some bad experiences with. But a lot of times it has nothing to do with us personally in our profession. It has to do with what's going on within the community. And I can even tell you personally, there are some people who have been told, you know, if you reach out for that, it kind of dumbs you down. It makes you look like you are ignorant, or dare I say, stupid, you know, like you don't have all the facilities that you need to be able to be successful, and now you're embarrassing the family. Why don't you pray about it? I mean, I could go on and on where that stigma, you know, it's embarrassing. We keep everything in the house. You don't tell anybody about any dysfunction that you have. It goes on and on and on. And we can smile all we want to and say, come on, we welcome you. If we don't deal with that issue and respect that issue, we won't get anywhere. Kevin, has anybody posted anything in the chat?
No, I'm not seeing any responses to that particular question.
Okay, all right, we'll keep going. So now, guys, we're going to shift gears. I kind of started already talking about us as we mental health professionals, and we're smiling and we're like, come on, come on, come on. We're ready to serve you, right? I want you to think about your agency. I want you to think about who you represent. I don't know if you represent an agency. I don't know if you're in private practice. I don't know if you just, jumped on here because you have another way unofficially that you connect with the mental health community. But I want you to look at how you respond and the agencies that we're connected with. What does that really look like when people walk in? So your advertising, that's the first thing we're looking at. What do the pictures look like? What does your Facebook look like? What does your social media look like? What does your website look like? Does it look welcoming? So remember, we've talked about those barriers. We've talked about the stigma. So all of that, before they even walk in your office, they've had to overcome all of that. So when they get there, it would behoove us to make sure that it is a visually, before you even open up your mouth and say, fill out this assessment, right? Before you even do that, visually, what is your agency saying? So I don't know if people have thought about this, but even your staff, do you have staff that look like them in your agency? What does your front desk person look like? What's their attitude like? Maybe you have somebody that has to do like their intake or give them paperwork to fill out. What's their response to Blacks, Indigenous, people of color? All of that has something to do with before they even walk into your office for treatment. So I did mention earlier a little bit about religion, but I want to go ahead and read this. Religion can be a protective factor for mental health in BIPOC communities for faith and prayer, but can also contribute to the stigma. So I added this part: target religious institutions to encourage mental health and wellness. And as I chat a little bit more about this, I am asking you, what else can your agency do to be more accessible? If anybody wants to throw that in the chat, they can. But I want to mention this. I really feel like it's time out for barriers and boundaries. To me, no place is inaccessible when it comes to mental health. People who have issues with mental health are everywhere. They are in church, they are at the mall, they are at the gym, they are everywhere. And so we need to be everywhere. We need to be advertising everywhere. We need to partner with places where people are. And that includes church, that includes religious organizations. It is a protective factor for some people. But at that same time, if we are able to get in that space and say, hey, we want to partner with you, can we maybe come and speak to your group? Can we maybe come and speak to your congregation? Can we leave some flyers here? And I always feel like if you can get, I call them like a one in. When I'm trying to network, just give me one person that I can talk to say, can I give you my spiel? Can I share with you the benefits of this awesome program? I'm doing that right now with First Star. Give me like one person. And I guarantee you, if I can impress you, it's going to trickle throughout your group, okay? So if you connect with one person within that community, even if they're connected with a religious organization, so let's go out for coffee. Let's do lunch. Let's get to know each other and be able to share what you can do and what the mental health community has to offer. And you're not trying to like jump in and push a lot, but you're just opening their minds to be able to hear what's accessible. And maybe they will take it back to the community. And when they take it back to the community, because they're the person that they trust, they don't know you. They can't trust you yet. I'm gonna be honest. I'm not trying to hurt your feelings, but it's the truth. They don't know you, but they know that person that you connected with. So now that person can go back and they will share with the community, hey, I met this person, I met Stacy, she was really cool. And she shared this. And I think you guys might want to hear what she has to say. Maybe you do coffee again with them and they bring 2 or 3 more friends. So it's a work in progress. And we in the mental health community have to be patient, we have to be respectful, and we have to be understanding. If there's nothing,
Yeah, can I share a couple of comments with you?
Please.
Yeah, one was from Jamie Donahue, and they say at YWCA, our overarching slogan is eliminating racism, empowering women. Having this on our marketing materials is empty if it is not backed up by having accessible. And let me ask you this question. Should I be saying BIPOC like an acronym, or should I be saying BIPOC? I've heard people say it both ways.
I've heard both ways as well.
Okay. Okay, I wanted to make sure there wasn't some standard way. I'm very particular about that sort of stuff. So anyway, the question says,
I've heard it both ways as well.
okay, the comment continues to say, it's empty if it is not backed up by having accessible BIPOC employees, which I think it definitely has, at least with stepping stones.
Thank you,
I have one
Jamie.
comment. I have one comment from Rita too, just going in line with what you were saying, that identifying both formal and informal leaders in communities goes a long way to spark engagement and buy-in in communities. And I think that that's a really important point to drive home too. And I have one other comment here. It says, some stigma comes from outside the mental health system, but have there been times the mental health system has been trustworthy, or hasn't been trustworthy, or has been untrustworthy?
Absolutely. And I'm so glad that somebody brought that up. Are we trustworthy? And this is, this is a hard topic to talk about. It's almost like doing a self-evaluation. I've thought about this. And that's why I said, what's in a name, in your agency name? So what's going on around you? What are your colleagues talking about? What is your supervisor talking about? Are you the supervisor? Are you really promoting and encouraging open atmosphere for people who are Black, people who are Indigenous, people of color to feel welcome, to work there and get served there? I mean, this is a lot to really think about. And I love whoever made that comment about people working there, because, quite honestly, you kind of do gravitate to people who are in same, I say same season of life, same ethnicity as you, okay? The NAACP, I'm not sure if people knew about this, but just a few days ago, they did a town hall meeting about the vaccine. And I might be getting ahead of myself because we're going to talk a little bit about that too. But, it was through the NAACP. There's your one in. Now, what if, I'm just going to suggest, what if somebody from the mental health community who is not part of this population that we're talking about said, I'd really like to get involved with this. And you show yourself open, encouraging, ready to really take a humble stance. And like I said, you're not trying to push an agenda. You're really trying to understand where they're coming from and give them a variety of opportunities. Hey, we can offer you this, 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 this. You're not trying to say, you need to come in for services, you need some medication, nobody want to hear that. We want to be able to say, where are you? And where you are is where we're going to start. And if you don't even want to go any further, I'll stick right here with you where you are. I'm not trying to make you into anything else. I want to sit in this with you. And to be honest, that's really where we as mental health professionals will gain trust, because you're not trying to push anybody or try to twist them into something else, because to be honest, when they get out in society, that's what a lot of people are already feeling. That's the pressure that they're already up against. Okay, I think I'm going ahead of myself and I have more slides, so I'm gonna slow down, calm down, and go to the next one here. Okay. So we cannot talk about mental health and what's happening with this population without addressing what's happening with COVID and the vaccines. And I'm going to touch back on that town hall meeting that NAACP did, because that was about the vaccine. But first of all, let's look at this slide. So COVID vaccines and mistrust in the healthcare community. And that was one of the comments that Kevin just read. Mistrust. Black folks have 2.6 times the number of COVID cases, 4.7 times more hospitalizations, 2.1 times higher death rates. In the United States, as of June 2020, 57% of deaths caused by COVID-19 have been men. I'll tell you, these are heartbreaking statistics to hear. When I think about how COVID has affected people of color, it really does shine a light on the disparities in our country. I think, you know, it also shines a light on the fact that this is more than about the virus, right? It has exposed another virus. I think that, to be honest, I could go on and on. I made myself like downsize this, but there are so many articles out here about lack of access to testing for people of color, loss of jobs. Now, and we're talking about people who are essential workers. A lot of people of color are the ones that are serving you at the grocery store. They're cleaning your hotel rooms. And they are essential workers and they are exposed. And a lot of them go home, especially those who are lower income, a lot of them go home to a family that is living in a small environment and there are multiple people there and they can't find a place to go close themselves off and stay away from people. It's just impossible. It's impossible to quarantine. So of course it spreads. What's the next thing that we see? Okay, now it spreads, now they have COVID and they're uninsured or underinsured. What's the next thing that could possibly happen? They go to the doctor, they're not listened to. I mean, I could go on and I'm sure you guys have seen this. This isn't anything new to you, but it needs to be discussed over and over again so that we as mental health professionals can be informed and prepared. So when that person walks into your office, you are aware of not even even if they haven't experienced it, if they've seen it. I've seen it in my own family, I've seen it in my community, and it affects me. So what's important to notice is that, like I said, there's diversity within each population, right? So there's diversity within the Black community. There is diversity within Indigenous people. So there's a lot of diversity going on within each group. And everything that we're talking about is not going to affect everybody. It's just not. However, even if it is not directly impacting each person, there's definitely some residue. There's definitely something that touches your heart, something that causes burden. I did, off topic a little bit, but I got time, I think, so I can do this. I did a study about police brutality in the Black community. And one thing that really was interesting for me to read was that most communities where there has been violence, abuse, murder even in the Black community, test scores go down for children in school. And it really isn't a surprise. It hurt me to read it, but it wasn't a surprise. Now, what the study showed me was that even if like these kids in school, it wasn't their family member that had this issue with the police. They may not have even known them, but it's being talked about in the community. It's on the news all the time. Their parents, I'm sure, you know, are talking about it. All of that. So all of that burden and heaviness affects you mentally. So again, even if it is not done directly, there is still an impact and it impacts the whole community. That's where that mistrust, so bringing this back full circle, back to mental health and really the medical field, that's where that mistrust comes in. So for example, maybe it didn't happen to me directly, but if I hear my aunt on the phone with her friend and she's saying what happened to her when she went to the doctor and how the doctor didn't listen to her and now she's feeling even worse and her, you know, she wasn't able to get her prescription filled because of her insurance, and it goes on and on and on, that is going to affect me. So I want you to understand that this is a large compounded and comprehensive issue that needs to be addressed. So back to my slides. Sorry for going off on a tangent, but I thought it was necessary to talk about this. We're gonna keep talking about it. All right, so I'd love to hear your thoughts. If you could put it in the chat about this picture. Some of this is what we were really just talking about. It says here, and it's talking about the population that we're discussing today, not having access to testing, live in high density. And remember when I was talking about they come home and they're in areas where they're not going to be able to quarantine. They can't say, oh, I'll just go to a hotel for a few weeks, or I'll just go stay someplace else. There's no resources to do that. Exposed to pollution, and you've already seen the higher numbers in highly populated cities where there's more pollution. Have a pre-existing condition. To be honest, everything we just talked about, living in high density, exposed to pollution, all of that already tells you that there's going to be some pre-existing conditions. And I think we talked about this earlier about how your mental health and your physical health really go hand in hand. And when you talk about traumatic things that have happened that affect your mental health, it is going to cause medical conditions as well that need to be addressed. So I'm an advocate for addressing both. You can't do one without the other. Now, one may take a priority, obviously, just to be able to function, but you have to be able to address both. So all of these things on top of racial bias in healthcare, this is something that you can look up. You will find it, to be honest, any and everywhere. When I researched this, it was something that was going on really throughout the country. And what's really sad about it is I'm not so sure if the medical community understands or sees the racial bias. I really wish there was a way that we could kind of all come together, because helping professions are helping professions. To me, as far as whether you're in mental health or medical health, we all go hand in hand. And I'm not so sure if they really have an understanding of what that bias looks like. So I'm going to ask Kevin, has anybody mentioned anything in the comments?
I got a couple of things here. One is from Marita Landreth, which is one of my wonderful coworkers, and she says that white people in healthcare in general are also extremely hesitant to see racial bias in healthcare as something that we directly and indirectly participate in. And she put an example like, oh yes, don't be racist training is for the racists, not for me. And you know what? And just hearing that, I can identify with that so well, because that is the thought, especially working in mental health and being a little bit slightly more in touch with these sort of things. You think, obviously this isn't for me. I have nothing that I could learn from this. And I think a lot of people kind of take on those feelings too, and treat
That's
those
right.
trainings that way.
Yes, absolutely. Do we have a stigma about racial bias? Is there a stigma among us as professionals that we don't need it? We don't need cultural competency training? Is there a stigma that's like, oh, that would never be me?
Yeah,
I don't know.
Absolutely. I think absolutely there is like that sort of belief sometimes that we're above those issues and that there's no further education necessary.
Exactly. I've gone to school. I've read all the reports. I watched the videos, but I'll have to, again, I'm gonna go off subject just a tad here, but I promise I'll bring it back. I am meeting a lot of PhD professionals since being back in school. And one of the things I admire so much about my teachers, and it's contagious because now I'm kind of like this too, but they are so excited about what they're learning. They are excited to teach, but like when so many of my teachers would be like, I just found this out and I'm going to share this information with you. Read this article, watch this podcast, and they don't know it all. And they don't come off as know-it-alls. And so we all have more to learn. And like I said, it's contagious because I don't know if I was ever in a place where I felt like I didn't have anything more to learn. Did I want to learn it is the question. And I think that even those of you who are on this webinar, I applaud you for humbling yourself, for wanting to be on this, for having a desire to learn more. This certainly is just a tiny, tiny piece of the information that's out there on this subject, but we all have more to learn. We all have more to learn.
I have one other comment for you real quick.
Sure.
Well, two things actually. The incredible Dr. Stiff actually followed up and provided a YouTube link to the NAACP webinar that you were talking about earlier. So I'm going to go ahead and share that in the chat right now.
Great.
But we also have a comment from Jamie Donahue that said, unfortunately, every single one of these things is contributing to why the pandemic is disproportionately affecting BIPOC, especially the racial bias in healthcare, since pain symptoms are often downplayed for Black individuals as well.
What was that last part you said?
That pain symptoms are also downplayed within the Black community.
Yes, downplayed. And that's part of that racial bias. I can share this with you personally. As a Black woman, married to a Black man, I have two gorgeous daughters. When I was preparing for this, I had to do some self-reflection myself and just really look at how I view my own experiences as far as mental health and medical doctors. And I hadn't really thought about this in years, but my dentist, my doctor, my own therapist, vision, my children's pediatrician, all of them are referrals that I got from people within my circle of friends, within my community, or my church, or people that I know and trust. I don't have anybody that I have been seeing for medical care or mental health care that I found on my own. All of them are people that folks I know and love went and had a great experience with them, and now I'm with them. So this brings up two very important things. The first one is that it goes back to what I said about getting that at least one in the community where you can build trust with somebody who can then spread the word. And as I think about it, even my doctor, the woman who referred my doctor to me, told me how he respected her, told me, how he really listened to her. And he was her regular medical doctor and her children were grown, but she was like, I wish I could go back. She said, I wish he had delivered my kids. He's just so awesome. So, people talk. I mean, think of your own life. Aren't there people that have given you advice or referred you to somebody, or you looked at them and said, oh, who helped you with this or who helped you with that? We live off of referrals. We live off of recommendations from other people. So it's even more essential with the population that we're talking about because of the mistrust. I will tell you that I think the flu vaccine has been out. I don't know if anybody knows, you can put it in the chat, but I know it's been out a long time. I didn't get that flu shot for a long time, and I was not giving it to my kids. So I noticed my own self. I said, oh gosh, I'm kind of like that too. Because I was like, I don't know what it's gonna do. It's gonna make me sick. I don't know. But after a while, and my mom got it and other family members got it, I said, okay, maybe I'll do it. And my whole family, we've been getting it for years. But I've had to do some of myself, look at myself and say, have I ever felt like this? Listen, this vaccine, I know Black people who feel like it's going to give them a chip in their arm. I know Black people who feel like they will die if they get it. And I'm talking about people I know personally. I know people who just say, maybe I'll get it next year. I got to make sure that other Black people that I know get it and they are okay. And if they're fine and there's no residue, there's no problems with it, then I'll get mine. And somebody even told me, I'm just gonna stay on my knees and keep my mask on and pray about it, and I'm not gonna get it. So that, I hope that you go to that link that Dr. Stipp posted. The NAACP doing that town hall meeting within the community, about the community, by the community, huge, huge impact. I will share with you that my mother, she's getting the vaccine. I am taking her personally, okay, Friday, to get her vaccine. She's 79 years old. My mother is a Black woman. She is legally blind. She's an amazing, amazing woman. This pandemic threw her for a loop. It really did. She's very active in the community. She's out and about all the time, very independent, and my family, we respect her independence. But everything shutting down and not being able to follow through with her routine was very difficult. And she, because she's who she is, she has developed a whole bunch of other things. If you contact me personally, I can tell you, and you will be inspired and amazed. But she has started doing a lot of other things for her own mental health, to stay engaged with people. But my point is, when the vaccine came about, I remember at first she even said, I don't know. I'm not sure. Then when she was sure, she couldn't get in. It's so difficult to get on the list. It's so difficult. And she's in that first priority phase. She's 79 years old. It's very difficult to manipulate the website and all that stuff online. And so my sisters and I, my niece, we were like, you don't have to worry about anything. We will take care. And when I tell you we got on top of it, we were like, oh, you're getting vaccinated, and it's going to happen as soon as possible. So we all, got on the hustle. And so I'm proud to say I got her appointment, and she's going in on Friday. But my point is, my mom has had family. We pretty much took that process over for her, and all she had to do was get a call from the people saying, oh, you, and my mom called me. She said, oh, I got an appointment Friday at 11. I said, yeah, you got an appointment, okay. So what about the person that doesn't have anybody to do that for them? What about the person who doesn't understand how to get online and figure all that stuff out? They don't care about the website and how to get online and register. Register for an account? Come on. They don't know how to do that. Or they don't have access to it. What do we do for those people? So this is a concern. And I know I have more slides and I'm off. Okay, let's keep going.
I have one more comment for you for that last slide from Mary Campbell. I think is probably just a good one to cap it off. And it says, I don't think anyone could have lived in our country and not hold within them some level of bias. We all have more to learn.
And if I'll just say this, because I'm biased and I love Mary Campbell, but if she can say that with all of her knowledge and skill, that we all got work to do. We do. We all have work to do. And I'm going to start.
I'm going to repeat that one time because I think a couple people didn't hear it. Maybe the microphone's cut out. But Mary Campbell said, I don't think anyone could have lived in our country and not hold within them some level of bias. We all have more to learn.
We all have more to learn. And I guess that's also the theme with to add into that, what's in the name. We all have more to learn. And that's a great way to kind of begin closing this out, Kevin. Our response as mental health professionals, we need to acknowledge fears and concerns and don't dismiss them. And I think even in our attitude, it's easy to do that. It's easy to kind of say, well, just get it, just get the vaccine, or what are you afraid of? Just go get some help. You can get some help, or to tell your family member to go get some help. We need to make sure that we're being respectful of where people are. And we need to partner with minority groups and organizations. Now, if you don't take anything else away from this, boy, I hope you get this part. And I'm an advocate. I love wraparound services. I love partnerships. Nobody can do this alone. You just can't. And guess what? Let me come off of this. All right, tiny soapbox moment. Who do you trust within your professional colleagues? I'll be honest. In my time out in the field, there were places that I knew I could send my clients to, and I knew they would be respected. I knew they could get the help that they needed, and I knew they would come back to me with rave reviews. And there were places that I would, quite frankly, not send them because I was not pleased with the services at this place. And I knew that their website and their voicemail said, we'll do this, this, and this. But every time I send somebody to you, they're coming back empty-handed. Or maybe they got something, but they were so completely disrespected. By the time they got the services, they were worse off when they left. So who do you trust within your colleagues and within your community? We have to be able to trust each other. We have to keep this conversation going so that all of us are informed. And I know I can trust you with my clients. You can trust me with yours. So partnerships, to me, are invaluable. And there's no competition. You do what you do best. Let me do what I do best. I bet if we all come together, we will make an impact. So partner with these organizations, faith-based institutions. We already talked about institutions. We already talked about NAACP. Radio stations. WXRJ is a Black radio station here. So this is something that if you want to advertise, you want to be able to get in, you want to be able to get in with these communities, go to the radio station and say, hey, do you have maybe some sort of opportunity where maybe I can be interviewed? And I'm talking more than just, please visit our agency. We will help you with no, I'm talking about get to know people. Let them get to know you. I'm not talking about a quick advertisement. That's good. That's a first step. But there's got to be more. There's got to be more. And a lot of that more that I'm talking about may be an uncomfortable conversation. It may be exposing a little bit more of yourself personally. But that's really how that trust is built. So radio stations, social media. You guys, there's so many BIPOC, mental health organizations, websites, Facebook. There's so much going on social media right now that it would be very easy to get involved, to get connected, to be able to watch the posts, watch the videos, get connected with these resources. Stay engaged in discussion about BIPOC and the vaccine. Because you guys, we are just starting out. There's going to be a whole lot more, I really believe, regarding this vaccine. I think among us as mental health professionals, we have to undo some damage. And I'm sorry, because I know some people, I might be stepping on your toes. I've stepped on my own toes here. But we've got to undo some damage. Even unintentional. I'm not talking about intentional people. That's a whole nother presentation probably. But those who have unintentionally been disrespectful, unintentionally, those microaggressions, you didn't even realize it. Now is your chance to undo it. Why? Because it's another day. Why? It's another day. Still have breath in your life. We still have opportunity to make things better. Your name, let's see here. Your name is your reputation. This is my last slide, Kevin. What's in a name? So this is going to really bring us full circle back to the beginning of what I was talking about with the name. What's in your name? So I'm looking for you to have some transparency with yourself and have some reflective questions here. What would people in this population say about you and how you treated them if they came to you for services? Remember I told you about the recommendations and referrals that I got for the doctors that I see? What are people saying about you? The programs that I ran when I was working at Bloomington Housing Authority, I would advertise them But most of the time it was because somebody came and said, hey, I saw that you helped so-and-so with this and you assisted them with this or that. Can I get some help too? Or is there something that you can do for me? Most of the advertising is good, and please don't stop doing it. But it's your personal engagement that's going to tell what your name is. What's your name out there? And what's your name? And I'm going to say this again because I think it's just that important. What's your name with this population? And what is your name with your colleagues? Have you ever watched a movie, read a book, listened to a podcast, or joined a group to learn more about this culture? And we just talked about that. Are you an advocate for people from diverse cultures to be hired? Now, here's my bias. I love the helping profession. Obviously, I better. I'm back in school after all this time to get my master's in social work. I love social work. I love helping profession. Love counselors and therapists. And I just think we are the most valuable people in the whole world. You want to know the truth? I really do. So why are we recruiting for this group of professionals like we do for STEM? Now, I'm sorry. I bet some people are saying, no, but technology is where the money is and we need to get them in engineer. And I honor that. I totally respect that. But it is not for everybody. Please don't. I am not an engineer. There is nothing in me that I would be terrible, okay? I'm a social worker to my heart. And there are other people, I bet, if you think about it right now, young people, high school students even, that I wonder, do they really know what we do? That we can let's start grooming people now, especially people from this population, to want to come into our career, to come and see the value of mental health professionals is an amazing thing. You guys, we get to watch people's lives change. Lives are changed because of the work that we do. Now, we want them to be changed for the better. And if we stick with this kind of conversation, we can build trust. And this is what my last point is. Building trust often happens because of referrals within the community. Your reputation matters. So I leave that with you. What's in your name out there in this community? Whether it's with the colleagues or with this population we're talking about, what's your name? What's your reputation?
All right. I'm going to give my own round of applause, Stacy. Very good job. We're always happy to see you, but even happier when you're doing an awesome presentation like this. I'm going to go ahead and open it up now. We're going to take about 10 minutes here to answer questions. If you guys want to go ahead, we'll do about 2 or 3 minutes for you guys to type those in there. I want to do an additional shout out to Stacy too and let everyone know we did have some technology issues, and Stacy hung in there with us and worked it out and even came all the way down to the health department to hang out with us today and make sure we got a good presentation for you guys. So thanks again, Stacy, for bearing with us and getting through all of that. You're always willing to help us out, which we really appreciate.
Thank you, and thank you for having me. And I tell you, this is a challenge to sit and look at a darn computer. But I appreciate the dialogue. I appreciate people giving their comments. I am a walker. I don't know if you guys noticed, I kind of swivel in my chair. I like to move when I talk, when I do a presentation. I like to engage with people. So this has been a challenge. However, I have self-regulated myself so that I could get through it. So I appreciate the encouragement, Kevin. Thank you.
Definitely been the biggest challenge for speakers like you that I know are really engaged and want a lot of participation is doing the chat and then, having a little bit of lag in between and all of that. So thanks for hanging in there. I know it was a lot different. And thanks to everyone that did participate in the chat. This is probably some of the most participation we've had, at least live, during the presentation. So I'm very grateful for that.
Awesome.
So I guess I'll share like a unique struggle I think that we have too that's kind of in line with some of the things that you said. So our triage center here deals with individuals that are experiencing a mental health crisis. And because we are with the government and McLean County oftentimes is right before our name, I think that there's kind of this perceived second level of mistrust sometimes that we're the government. And we really have to take the time to remind people that they're not in trouble when they're here. and going that extra step. And I'm wondering, what kind of suggestions you would have for that first encounter of trying to, put people at ease. Are there general strategies or things I could do or our security staff could do, who's one of the first individuals that sees someone with this mental health crisis when they come in? Now, we already have made considerations for things we can do from the get-go when we were first conceptualizing this program before I was ever here. Not having our security staff dressed to look like law enforcement, which would be a trigger for some people. Having them be more trauma informed and have an understanding of the approach they need to make as far as the words they're using, the tone they're using, eye contact, all of those things. But are there other general recommendations maybe after that fact when they're past security and talking to one of our specialists, things that we can do to better serve that community?
Sure. So I love triage and fuse. I love the programs that are being run through McLean County Behavioral Health. I did my summer internship here, and I, of course, am biased, like I said, regarding mental health professionals. And I think this program, they should be like overwhelmed with people coming in, seriously. So
we're definitely getting there. I'll tell you that. I know, Stacey, you've been gone for a while, but we started during COVID. Our numbers are definitely picking up. So it is happening.
Because it's a great program. Okay, so back to your question. So two things. The first one is, verbally, I would say, speaking to people who are already in crisis over and over again, letting them know and reassuring them that you are not connected in that kind of way where there is going to be a consequence for them getting treatment. And you are right, with being connected to the government, that shield is already up. That boundary has already been put up where they're like, I don't know if I can trust you, and I don't know if you will be able to really help me. So that's the first one. I don't know if it should be, if that standard, hey, we are not connected to the government. We are not here to try to, deport you or put you in jail. There's a way to communicate to people to build trust. And I would say, even specifically with this population, it most likely needs to be repeated. Don't we all need things repeated to us sometimes when you're nervous and when you're anxious, and now you're also talking about people who are dysregulated and in crisis? Yeah, you're gonna need to repeat it, over and over again, and in a meaningful way. I'm all about meaningful interaction. There's something about it when you're able to really connect with that person on a meaningful way, and not our standard, I'm reading this, the directions to you, I'm reading the script. People can see right through that. People can see through it. So are you able to really connect with them in a meaningful way? So I love that even the security guard is trauma informed. That's wonderful. I think I said this already. Your front line for here, it's security guard, and then I think you guys have somebody at the front desk.
Yeah, we also have a peer specialist with lived experience, mental health or substance abuse issues.
So that front desk person is important, and they may not be mental health trained. They may be, you may think they're the person that just takes their name, but there's a whole lot to that person that really needs to be informed and prepared, because that is the first step in the real name and reputation of your agency, that person at the front desk. But the other side of that I think is so important, Kevin, I'm all about proactive. Those connections in the community that I was talking about would be a huge, huge help. Get in. We need to get an in with the community, because I'm gonna tell you something. Some of them is closed with a solid steel door, shut and locked, and they're not letting anybody in. So if you can get a little bit in there, get at least, like I said, one person that you can say, hey, can I talk to you about triage and what we do? Then they will be able to tell other people who will tell other people. And somebody that they tell is going to say, I have a relative who could use that place. And now I know I've got a place I can go. I know a place I can take them. So there's something about being able to connect with people when things aren't in disarray and crisis. Let's build relationships and partnership, formally and informally when we're not in a crisis. Let's build that relationship now, so when the crisis comes, they'll be able to say, oh, I already talked to somebody. I know a name. I know somebody I can talk to. Because I know Kevin, now I don't know all the staff that are here, right? But because I have dialogue and I talk with Kevin, if I know somebody I'd say, Kevin's the one that he's the one I talk to. You see, there's something about that name. What's in a name? There's something about being able to have an in with that contact. So a lot of what this agency, many agencies need to do is some of that formal and informal, proactive, making sure that people completely understand what you do, who you are, and even the efforts that you have made to make this an inclusive, welcoming environment.
Awesome. That is such an awesome answer. Absolutely agree with everything you said. We have a lot of thank yous coming in for you for this presentation. A lot of names I recognize from ISU, a lot of people I haven't had the opportunity to see in a while. So great job there. I have one other comment before we sign off here. So this is from Marita Landers. She says, something I've been trying to be more thoughtful about as a white woman is making space for BIPOC voices by stepping back. If I was looking at an opportunity to pass BIPOC individuals, where might I reach out locally? Do you know of any resources where maybe there's an individual that would be better suited to talk to a BIPOC individual if she feels maybe she needs to take a step back on a particular issue or subject?
Yeah, I would start with the NAACP. I would start with now. Oh, okay. I'm gonna give a real quick commercial. If you've heard of the Multicultural Leadership Program, great organization, great program. The Bloomington Normal, it's called MCLP. I don't know if Mary Campbell's still on here, but they gave her a beautiful award, and I was there. But it's a program where they very intentionally bring in diverse populations to really work together on community projects. And that is an awesome time to be able to come together. They have a lot of discussions personally, professionally, and then they communicate what they're seeing in a community. There's just so much to it. And this is a 9-month program, and it's a lot of work. They do require you to volunteer your time. They even connect with community organizations and encourage you to be a part of a board and also to help community organizations. But what I like about it is these are diverse people. So it may be Black, Indigenous, and white, and people of color. You're all on one team and you are given a task and you need to complete that task together. And that task is designated with a particular agency in the community. So it's awesome. I'm an advocate for that program. And there are others out there that are like that, where you can get engaged and have conversations. I think our desire, and it's understandable, is that we want to have a safe space to have these conversations. Because, well, what if I say the wrong thing? And I think that's understandable. But I am one, and I'll tell you, since I've been back in school, I have been fearful of that too. I have learned so much. Like you said, Kevin, is it BIPOC? Is it BIPOC? I've heard both. But I know this. When I come across the way I communicate, it is my every intention to come off respectfully. And I had to really talk that through to myself, even in some of my classes, that, dog, I said that wrong. Oh, that's it, and I had to really kind of show myself some grace to say, I am still learning. I am doing the best I can. And if I have made a mistake, has not been intentional. And I hope that I am communicating in a way that shows grace. It shows respect. It shows that I honor your name.
Absolutely. Mary says that's spot on, by the way. NAACP and MCLP, we are blessed to have both of them actively working to transform our community. I have a couple more thank yous for you here, but that is the extent of our questions for today.
Sure.
I am going to go ahead and, like I said at the beginning of this presentation, go ahead and post the YouTube channel for McLean County Behavioral Health, as well as our events page, so you can sign up for future presentations. I usually have these videos up within 24 hours. So Stacy, if you want to share this with anyone or anyone viewing today wants to share this video or any of those on our YouTube page, they'll be available for you there, hopefully by the afternoon tomorrow. I think there was a couple other things I wanted to share real quick. I can't remember exactly what they were. Oh yeah, if anyone watching this video on YouTube or watching it live now has any questions for Stacy, you can reach out to me using the information located on either of those pages, and I can reach out to Stacy and get answers for any questions that you might have. So that's it for me today. Thanks again to Stacy for being here. I really hope we get to have Stacy come back and speak for us again in the future because we just love having her. And thanks again for all of you who participated in today's presentation. Have a great day and enjoy the moderately warm weather that we have out there.
Thank you.
Thanks. Bye.